ongoing basis according to the institution's policy, and never leaving the client alone when the restraint is temporarily removed for evaluation. You'll assess a client in restraints at least every 30 minutes and remove the restraints for a complete evaluation and range of motion exercises every 2 hours. Older adults are at greater risk for falls and injuries as a result of diminished hearing, sight, reflexes, bone density, and flexibility. Using restraints with older clients to prevent injury is not without risk, however. Skin that has become fragile from the loss of adipose tissue and from poor circulation can be damaged by the friction and pressure of restraints. And struggling to be free of the restraint can cause additional injury, for example, from climbing over side rails. Very frequent evaluations and thorough documentation of findings for these clients will help you identify problems promptly. You must also help promote their dignity and self-esteem. The use of restraints is very difficult for clients to accept, so your thorough and compassionate explanation to them and to their family is essential. Remember, when you must restrain a client, your goal is that the client will be safe and free of injury without loss of dignity or violation of their client or human rights. Now let's go ahead and view a demonstration of applying a wrist restraint to an adult client. We'll assume that the nurse has checked the provider's order and has explained the procedure to the client. The only equipment the nurse needs is the actual restraint, in this case, a wrist restraint. We will assume that the nurse has checked the provider's order for the restraint and has verified the client's identity. The nurse first assesses the skin area over which the restraint will be applied, making sure it is intact and that there is adequate circulation to the extremity. Following the manufacturer's instructions for the particular restraint, the nurse then applies the padded portion of the restraint carefully around the client's wrist. She pulls the tie of the restraint through the slit in the wrist portion, making sure that she can easily insert 2 fingers between the restraint and the wrist. Using a quick release knot, she attaches the ends of the restraint to a portion of the bed frame that moves with the client. After application, she then checks the client's hand for adequate circulation. After applying a restraint, you document the behavior that indicates the need for restraint, your initial assessment, and the type of restraint you applied, along with any teaching or other nursing actions you took to support the client and the family. Remember, you must use restraints only as your institution's protocols allow, and never without a provider's order, in an unsafe manner, or without frequent observation and reassessment of your client. The purpose of the restraints is defeated if they injure the client in any way. Every joint in the body has a specific range of motion. It is the maximum amount it can move in any or all of 3 ways, front to back, side to side, and in a transverse manner, depending on the nature of the joint. Putting joints through their normal range of motion helps prevent stiffness and loss of function. When a client cannot do this himself, for whatever reason, a nurse, a physical therapist, or other caregiver must do it for him. The process of moving a client's joints through their complete range of motion and stretching the muscle groups that normally move those joints is called performing passive range of motion exercises, or passive ROM. Passive ROM exercises are intended to help maintain joint mobility and flexibility, not to build muscle strength. It takes participation on the part of the client to build muscle strength, such as when a client performs active ROM exercises. Passive ROM exercises prevent shortening of muscles, ligaments, tendons, and joint capsules, thus halting the development of joint deformities. Deformities are caused by permanent shortening of the muscles, which freezes the joint into a fixed position, resulting in a contracture. Passive ROM exercises help prevent hypostatic pneumonia, thrombophlebitis, foot drop, circulatory problems, skin breakdown, and fecal impaction. They stimulate circulation and sensory nerve endings, increase endurance, and promote a sense of well-being. As beneficial as passive ROM exercises can be for most clients, however, they should be done for others only if the provider specifically prescribes them. Possible contraindications for passive ROM for some joints are acute arthritis, septic joints, a bone fracture, a head injury, a torn ligament, joint dislocation or subluxation, acute cardiovascular pathology, and acute thrombophlebitis. When a client needs passive ROM exercises, a physical therapist might be involved in planning an exercise program for that client, incorporating any precautions or limitations the provider specifies. Together with the therapist, you will ensure that each of the client's joints is safely and smoothly put through its full range of motion. When a client is newly immobilized, it is important to begin a preventive passive ROM exercise program as soon as possible. To perform passive ROM exercises effectively, it is helpful to understand the various terms the provider and the physical therapist might use in designing a specific exercise program for your client. Flexion is decreasing the angle between two bones that form a joint, or bending a part on itself, for example, flexing or bending the elbow. Extension is increasing the angle between two bones that form a joint, for example, straightening the arm. Hyperextension is increasing the angle of an extremity beyond what is normal, for example, bending the hand backward as far as it can go. Dorsiflexion is moving a body part in a backward direction, for example, pointing the toes upward. Plantar flexion is bending the foot so that the toes point downward. Abduction is moving a body part away from the midline of the body, for example, moving the arm outward laterally. Adduction is moving a body part toward the midline of the body, for example, moving the arm across the midline to the opposite side. Circumduction is moving an extremity in circles, such as swinging the arms in a cone configuration. Rotation is moving a bone horizontally. An example of internal rotation is turning the arm inward, while external rotation is turning the arm outward. Pronation is turning the hand so that the palm faces downward or toward the posterior of the body. Supination is turning the hand so that the palm faces upward or toward the anterior of the body. Inversion is turning a body part so that it faces inward, for example, turning the foot so that the sole of that foot faces the other foot. Eversion is turning a body part so that it faces outward, for example, turning the ankle so that the sole of that foot faces away from the other foot. Now that you are familiar with the basic terminology of joint movement, let's review some tips for performing passive range of motion exercises on your clients. First, be sure to check the client's record for any contraindications, and if you find any, make sure there is an order from the provider addressing whether or not to give or how to give passive ROM to that client. You might have to exercise some joints, but not others. Before you begin, you'll explain the procedure to the client and evaluate his ability to cooperate with you during the exercises. Have assistance available as needed. Also, ask the client to let you know if the movements are causing him any extreme discomfort or pain. If the client is confused or agitated, you will need assistance. Throughout the procedure, keep in mind these general guidelines. Adjust the bed to a comfortable working height to prevent back strain. Move the client close to you so that you don't have to stretch or bend excessively. Lock the wheels of the bed to keep the bed from moving as you perform the exercises. Work systematically from the client's head to his toes. Perform the exercises slowly, smoothly, and rhythmically. Jerky movements can cause injury and fast movements can cause muscle spasms. Complete each exercise maneuver 3 times, completing each set of repetitions before proceeding to the next joint. While exercising a limb, support the limb above and below the joint. Never force a joint beyond its usual range of motion. If the client reports extreme pain, stop the exercise and report it to the provider. If muscle spasms develop, stop the exercise temporarily and apply gentle pressure until the muscle relaxes. If the client becomes tired, provide rest periods between exercises. Now let's go ahead and demonstrate performing passive range of motion exercises on an adult client. We'll assume the nurse has verified any provider's orders related to performing these exercises and knows she can proceed with a full battery of exercises for this client. She has also explained the nature of the exercises to the client and is determined that he is likely to cooperate throughout the procedure. The nurse washes her hands, then